I would like to invite Dr. Amrita Sawhney, and she would be telling us about the power modulations. Dr. Amrita, I think your presentation is that side. Yeah. Over to you, Dr. Amrita.
Good afternoon, everyone. Thank you for joining us, and thank you for the opportunity. So I will be talking about the power modulation in phacoemulsification. So as we know that phaco machine has a lot of functions, and the interrelationships is called the phacodynamics. There are two main functions. One is the ultrasonic power, which I'm going to talk about today, and irrigation aspiration, which is the safe suction of the emulsified material. So I think Dr. Urvija has covered the piezoelectric quartz crystal which is present in the handpiece. So I won't be repeating that, basically converting the electrical energy into the ultrasound energy, and they're 2 to 4 in number. One thing I would like to mention here is that more the number of crystals, more is the stroke length. So that stroke length is basically the one which actually tells us how much power is going to be delivered. But we still say that these number of crystals, so suppose like we said 2 to 6 crystals are present in the handpiece. So more number of crystals, they will give you more stroke length, so the more power will be generated. Now the difference is in the frequency as well. So these crystals, they move at a certain frequency which can range between 29 to 60 hertz, but each machine has a fixed frequency. Now more is the frequency, better is the cutting action, but more is the heat generated, but ultimately the surgical outcome is not affected. So all the machines, they have a fixed frequency, so the power completely depends on the stroke length of the phacotip. The advantages of this system is high efficiency, in little heat generation, and no extra cooling is required. But there is also a disadvantage to the piezoelectric crystals is the inherent brittleness of the crystal itself. So the longevity of the transducer is affected, and there are a lot of connections between the piezoelectric crystals, so the whole system is quite complicated. Now, more importantly, we need to know how the phaco power is being delivered with the foot pedal positions. So we have two dentitions. This is common to all the foot pedals, most of them. Apart from the dual system, I'm going to talk about the general system. So there are two dentations, D1 and D2, and 3 excursions. So when we go to the first excursion, it is irrigation on, the pinch valve opens. So irrigation is either fully on or fully off. There is no gradient there. Then we cross the dentation 1 and we go on to the excursion 2, where irrigation and aspiration both are on. Then we cross the dentation 2 and we go to the third mode, where the irrigation is on, aspiration is at the maximum precept value, and the phaco power will be depending upon how much of the foot pedal you are pressing. Now this is about pressing the foot pedal. When you're going back, you go to D2 and then you go back to D1. Now this is important because you need to stop at D1. It is at this point that the irrigation will be maintained and anterior chamber will not collapse. This is very important when you are manipulating the nucleus, especially during step 1 and step 2 of phacoemulsification. Now, another important thing is reflux, that is a sidekick. So suppose you have gone and wrongly picked up the capsule or some kind of iris, and you want to kind of expel it back into the anterior chamber. So you just give a reflux, the sidekick. We must remember that it is not a continuous mode. So every time you want to reflux the tissue or you want to do it again, you have to kick it, put the reflux mode again. So before attempting phaco, even for the trainees, it is very important. They must know about the tactile feedback, that is the depressions while going down and while going up. And secondly is the auditory feedback, which is aspiration feedback. What is the auditory feedback when the phacoemulsification has started? Now we need to know that how much of the power will be generated with every excursion of the foot pedal, that how much of the foot pedal you press and how much of the power will be generated. Now this actually depends on two things. How much is the distance? So suppose the IAP 0 means the phaco energy is 0 and IAP max means the phaco energy maximum. Now the distance between these 2 points, suppose it is 100 millimeter and the maximum power that you have set on the console is 100%. Then it means when you press 100 millimeter, 100% of the power will come, which means 1 unit power will be generated when you press the foot pedal 1 millimeter. Now suppose you reduce this phaco power on the console to 50%. That will mean that 2 millimeter of the excursion of the foot pedal will give you 1 unit power. And similarly, if you reduce the phaco power further to 25%, it will mean that 1 unit of the power will be generated when 4 millimeter of the foot pedal excursion has been done. So when you decrease the preset value of the power on the console, it increases the foot gradient. That means more of the foot pedal has to be pressed to generate equal amount of the power. Therefore, the foot control becomes better. Hence, it is very important that the phaco maximum should be set at the minimum possible level which is required for a particular grade of the nucleus. So like we can say that for trenching, we need more phaco power as compared to phaco aspiration, and it is even lesser required in epinuclear plates. So it is very important to know. You have to tell your assistant, and even you should check yourself how much of the phaco power you have set on the machine. You can even feed them in the newer machines. So basically, there are two mechanisms how emulsification happens. One is jackhammer effect, that is a bombarding action of the tip. So it is a rapid to and fro movement of the tip, like we can see in this diagram here, which kind of disintegrates the nucleus. And the second phenomena is a cavitation phenomena. Cavitation phenomena means that there is a rapid backward movement of the tip. Now the tip moves faster than the fluid which is surrounding the tip. So it creates a kind of a bubble there, a hole, and the fluid fills into that bubble, and it kind of causes emulsification of the tissues. Now jackhammer effect, as we know, it depends on the contact of the tip and the nucleus. So it becomes very important that the hold is good. Only then the jackhammer effect functions. And the force with which the tip actually strikes the nucleus is given by the formula mass of the needle, which is fixed for us, and acceleration. Now acceleration is further given by stroke length into frequency, and as I mentioned earlier, frequency is fixed again. So the whole thing is completely dependent upon stroke length, so power is directly proportional to the stroke length. So this is how important the stroke length is. And cavitation, like I explained, that the fluid falls into the space that is created. It is better explained with this diagram, that whenever you are pressing the foot pedal, you are giving certain amount of ultrasound power. So this gives wave fronts of expansion and compression. That creates an area of high temperature and low pressure, and the whole system collapses within that cavity. Now the forward movement of the tip also gives an acoustic wave. So like in jackhammer effect, it pushes the nucleus away. So if your vacuum built-up is not good, it will actually go against the jackhammer effect, and the nucleus piece will be pushed away. But if your hold is good, then it will also affect the jackhammer effect. So we have to really look at the vacuum in every stage of phacoemulsification that we do. Now cavitation, when I say, it should not be confused with the air bubbles that we all experience. Sometimes they come in the anterior chamber. They are just the air which comes out of the solution in the anterior chamber or gets sucked into the system from outside. There are other terminologies like chatter. They are just the movements of the nuclear fragments. And sweet spot is one of the terminologies which is used. It's the exact point at the foot pedal where the nucleus piece can be easily attracted and can be emulsified. Now coming to the phaco modes, this is a very important topic. There are mainly two modes, the surgeon mode or the linear mode, and the second is a panel mode or the constant mode. Now what is the surgeon mode or linear mode? It means that it will depend on the amount of foot pedal that you press, like I explained before. So power delivery is from 0 to the maximum power that is set on the console. But it will entirely depend upon the foot pedal, how much of the foot pedal excursion is there. Suppose 1 millimeter, then how much 1 millimeter is giving, 2 millimeter, how much 2 millimeter is giving. Whereas in panel or constant mode, as soon as you go to the phaco mode, a full power will be delivered into the eye, which means that there is no variation here. The full power is delivered whenever you go to the phaco mode. Most of the surgeons, they prefer the linear mode so that they can have a better control. Whereas the only probable indication for the panel mode or the constant mode is where the nucleus is extremely hard and you know that it's uniformly hard and you need uniform energy. You can especially use it in cases like direct chop. Now there are other modes like pulse mode. I'm sure you must have heard about these modes. So pulse mode means each pulse of energy is followed by a gap. So the duration of the pulse that comes into the eye is equal to the gap that we give. Now this gap is very important because it helps in the vacuum build-up. Hence, pulse mode is a variant of linear mode where the frequency of pulses and the duration of pulses is fixed, but what amount of power will be delivered in that particular pulse will actually depend upon how much of the foot pedal you press. So we can see with the help of this example here. So this is the phaco on, this is phaco off. So this is a pulse and this is pulse off time. If you see, the foot pedal is here somewhere in the midway. So half of the power is being delivered. When the foot pedal is fully pressed, then full power is delivered. Suppose there's 50% power on the console, then when you press the foot pedal, 50% of the power, the whole of the power will be delivered. But the gap between the pulses is the same, so the frequency and duration of the pulse remains the same in the pulse mode. Whereas there is a modification to this. So on and off time is the same, and it is really helpful in stop and chop technique. So the modification is a hyperpulse mode. So hyperpulse mode means a bundle of pulses are clubbed together, and then there is a gap between these bundles. Now the catch point is, I'll explain with the help of this diagram here. So this is one bundle. So these are different pulses in one bundle. The on and off time between these pulses, within this bundle will be the same, but we can vary the time between the bundles, between the two bundles. Now you see in this example, this is one bundle, this is second bundle, but the time gap between all of them is equal. And again, this is based on linear also. So if your foot pedal is here, it is half of the phaco which is delivered in each bundle. When your foot pedal is fully pressed, the phaco which is delivered is the full power phaco is delivered as per the console. Now in this is a second example of hyperpulse mode where this is one bundle and the gap between the pulses is the same, but gap between the bundle has been increased. Now the advantage over here is a duty cycle. Duty cycle is basically phaco on time divided by phaco on plus off time. Now we can make use of this off period because this helps in cooling and lesser damage to the eye, lesser heat generation. So in first example, like we can see, it is 100 because this and this is equal. So it is 100 divided by 200, so duty cycle is half. Whereas in the second example, this is one bundle and then there is a gap of 900 milliseconds and then another bundle. So it becomes 100 by 1000, so almost 1 by 10. So it helps in reducing the heat generation. And burst mode is same as a constant mode where the energy is fixed. So if you see the foot pedal here, even when the foot pedal is here, you have maximum energy. And when the foot pedal is down, you have maximum energy which is delivered. The only difference is the frequency increases. So in the burst mode, when you press the foot pedal, it is the frequency increasing, but the power delivered will be the same. It is very useful in dense nuclei. Now, I think types of phacoemulsifications are very well covered by Dr. Urvija, and she's explained everything in this. The only thing I would like to say is, like Dr. Lal also mentioned, when you angulate the tip, the cutting becomes better. But the catch point here is, when there's an angulation, like Kelman tip, the tip which is below is quite angulated, so it can actually damage the posterior capsule. It can cause posterior capsular tear. So they brought about a modification which is called the balance tip, which again Dr. Urvija showed that it's forward angulated, so it's safer. Secondly, why angulation helps is because this is the base. Over here, the movement is less as compared to the tip. So when the tip is moving, the cutting is efficient, but at the same time, the heat generation, which is near the wound, that is less. Because this base is moving less, the tip is moving more. That is the advantage of angulation. That is how angulated tip came into play. This has been explained. Sir, do you want me to cover nucleotomy, or should I stop?
Can you talk about the power settings only?
Power settings only.
Related to the power.
Okay. So the purpose of nucleotomy is basically the central core of the nucleus is to be eaten up piece by piece without damaging the cornea and the posterior capsule. And the most common methods are divide and conquer and chopping methods, or a combination of two. Nowadays we are using stop and chop, where we trench, we start the trench, the first trench like divide and conquer, but we stop there, we rotate the nucleus and we start kind of chopping the different chopping techniques. And another important thing we need to know about is the central safe zone. It is the area which is vertically bounded by, on the top by cornea and with the posterior capsule behind. The maximum space in the anterior chamber is in the central safe zone. We should get the nucleus piece and the cortical matter into the central safe zone before we emulsify them. It is more in cases of myope, zonular stress syndromes and vitrectomized eyes, and they are smaller in hypermetrope, small pupil, and smaller X's. The peripheral unsafe zones are capillar fornices and angle region. We should avoid doing emulsification over there. Now, trenching is the most important step. It involves making a groove in the nucleus. This step is vital for stop and chop and divide and conquer techniques, and this should be performed under low vacuum settings because here we do not want to hold the nucleus. Now, the ideal power, how will we select the power in such cases? So it should be an ideal power where there is no wastage of energy and no movement of the nucleus. So a rough estimate is grade of the nucleus into 15 plus 25 is what you can set for trenching. And linear mode is preferable when you are trenching. Now, how will you know whether you're wasting too much of energy? So if there are bubbles which are coming in the anterior chamber, it means that you are giving too much of energy and there's really nothing to emulsify. And at the same time, if you're giving too less power, which is required, suppose there is a grade 4 and you're just giving very low power, you'll keep pushing the nucleus, and then that will cause zonular stress. So that is why there's an ideal formula. You can select it as per your needs, but that is the formula, grade of the nucleus into 15 plus 25. Now, length of the trench ideally should be within the capsular excess margin. In case of really hard cataracts or very soft cataracts, you can go under the capsular excess and you can go to the delineation margin where it is called relaxing nucleotomy. And when you want to widen it, like Dr. Lal said, we feel a bit unsafe if we are not able to see the tip. So it is better to keep the bevel up and then just widen it like this. On two sides, it should be ideally should be 2 dip diameters so that the sleeve doesn't get stuck into the trench. And then shaving, so how do you do it? So the best way is the tip should keep moving, should be up like this. It should keep moving like this, and the handle should be using the incision as a fulcrum. And once the superficial trench has been made and you've kind of widened it, then you go to the deeper trench. So then
Basically, then the setting, how the settings different are different in a trenching, chopping, and phaco aspiration.
yes. So
So in a power setting, because the aspiration will be covered by, so how the power setting will vary when you make a trench, and what your power setting will be when you are, how you vary your power setting in a trenching, chopping, and when after chopping you are doing the phaco aspiration.
yes. So, like I mentioned before, roughly the power settings is maximum when we are trenching and the vacuum is low. Vacuum will be covered by ma'am. So, when we are trenching, the rough formula I've given, grade of nucleus into 15 plus 25, that could be during the trenching. Once you've trenched, you crack the nucleus and then you rotate it. So, once you crack the nucleus, then you rotate. And once you have the 2 heminucleus, you start chopping them. Now, there are different ways of chopping, the horizontal chopping, the vertical chopping. And the power setting doesn't really vary in horizontal and vertical chopping. But in case you're doing a direct chop, in that case, you can have high power settings. Then, depending upon the grade of the nucleus. So, suppose you're doing stop and chop in a soft nucleus, you can keep the power setting as low as compared to what you use it in trench. But in case of hard cataract, you can use a higher power setting, and you can also use different modes. So basically, if you have a good knowledge of the anatomy of the nucleus, the instruments and machines, and the basic hand motions, you can even make the complicated procedure rather easy. Thank you.
Thank you, Amrita. I think basically when you are trenching, you can have a continuous mode. You don't have to have a pulse mode because it's a continuous process going on. And at the trenching time, you can have a high power setting as compared to when you are doing the nucleotomy. So because you want to make a trench. And at the time of trench, you are absolutely calm and quiet, and you can vary the energy level depending upon the density of the nucleus. But when you are chopping, probably you are more stuck. So while chopping, you need a little less phaco energy, and a pulse mode is better at that time. And for phaco aspiration, you can further lower the energy. Like suppose if you are using, depending upon the machine, 40% for the trenching, you can use 30% for chopping, maybe 25% for phaco aspiration. So as you keep on going up, the power can be reduced, and the pulse mode is needed when you are doing the chopping and aspiration. But trenching you can do in a continuous mode.
Depends upon the beginner. Surgeon is a beginner or a very proficient surgeon, so we can change, like pulse mode is more safer, and on the burst mode, more experienced surgeons, they can go on to the burst mode. So the beginners should not try too much of the